Mr. Speaker, school is starting next week for many children in Manitoba, and we need to focus here on what makes a difference in the cognitive and learning development of children. A psychological development study at New York University showed that of the many factors that could be involved, that 4 are most critical for cognitive development of children. One of these, interestingly, is ensuring that pregnant women and children are receiving sufficient levels of long-chain polyunsaturated fatty acids, particularly one vital for brain development, docosahexaenoic acid, or DHA. I would ask the Premier if he can help us and provide details on what proportion of pregnant mothers in Manitoba are deficient in DHA.
Mr. Speaker, unlike any other province in Canada, we actually have a prenatal benefit that's available to every pregnant mother in this province to ensure that they have proper nutrition and access to any nutritional supplements they might require. And that puts us ahead of any other jurisdiction. I know the member is aware of that. If he has specific recommendations he'd like to make to the Healthy Child program on the types of nutrition that should be available to people, we'd be pleased to receive it. Public health nurses do home visits out to these homes. Public health nurses are well informed of the requirements of young mothers, and if he has any additional information he'd like to share with them, we'd be happy to get it to them as soon as possible.
As the Premier well knows, too many children are not even receiving those nutritional benefits. We need to make sure not only do they get the benefits, but they're using them in ways that are going to be most effective. The Canada Food Guide says that pregnant mothers need adequate DHA during pregnancy. The International Perinatal Lipid Intake Working Group recommends a minimum of 200 milligrams per day of DHA during the latter half of pregnancy when the infant's brain is growing rapidly. Canadian studies show that the average DHA intake in pregnancy is far below international standards, averaging only 80 milligrams a day, less than half. I ask the Premier, what is his plan to address the DHA deficiency present in too many in Manitoba?
Again, Mr. Speaker, the member knows that we have a strong complement of public health nurses in the provinces of Manitoba. They organize and provide many prenatal courses for young families, mothers in particular. They're able to provide all kinds of important information with respect to nutrition as well as other basic requirements for having a child and raising a child in Manitoba. And again, if the member thinks that there's something they should be aware of that would help them in providing good advice and good support to young pregnant mothers in Manitoba, we'd be happy to receive that information. But we do have a strong public health care system in the province, and we will continue to support it and not do the across-the-board cuts that we've seen the member's office have promised on so many times. They were planning to lay off public health nurses. That's part of their broad-based approach to cutting government, putting a chill on things, and showing the tough love. We're trying to support young families, and we will continue to do that.
Mr. Speaker, this is not just about pregnant women and infants. A randomized controlled trial of children who were slow in reading concluded, and I table it, that DHA supplementation offers a safe and effective way to improve reading and behavior in healthy but underperforming children from mainstream schools. Mr. Speaker, I've called for an all-party task force to come up with a better plan to eliminate nutritional deficiencies in our province. How many nutritional deficiencies do I need to bring forward before the Premier acts? I ask, is the Premier ready to be part of an all-party effort to eliminate nutritional deficiencies in our province and help children, particularly those who are struggling?
Thank you for the article from the Leader of the Opposition. Mr. Speaker, we have a Healthy Child Committee of Cabinet. It is the only one in the country that's required by legislation. We have a Minister of Children and Youth and very capable staff over there that do a variety of longitudinal research studies on the effects and the positive effects of the investments we're making in young children and families in Manitoba, about $400 million, a very significant increase over the last several years and targeted. With respect to nutrition, the member knows that we have over 900 community gardens in northern Manitoba now, where there was just a handful a decade ago. He knows that we're a lead investor in the Nourishing Potential Fund, which provides a variety of different forms of food security throughout Manitoba. Community gardens, breakfast programs, nutrition programs, for children. And we have our public health nurses, which we continue to fund. We're not cutting these programs. And even the leader of the Liberal Party was not in favor of the budget. He was opposed to that and wanted to support the members of the opposition in cutting those programs. If he has good information, we'll be sure to pass it on to the people in the Healthy Child Subcommittee of Cabinet. They will take a look at whether the prenatal benefit and other programs we have can support this kind of research and whether we'll have the desired outcomes. But we're all very interested in seeing
Order, please.
the nutrition.
First Minister, time has expired.